Hi everybody, Dr. Daniel. Today I'm going to start this video off with an outrageous question. Does migraine kill? Well, the patient with migraine has such a bad attack, has terrible headache, it's throbbing, they're nauseated, they're vomiting, they're sick, they're confused sometimes, they have to go to bed, they have to change all their plans, they can't do anything. They sure feel like they're going to die if migraine doesn't actually cause death. So the truth here is that migraine really doesn't kill persons or cause death. And the way we know that is associated conditions have not been found that migraine is associated with death. And a large study was done in the year 2020 where they had 20,000 patients whose charts they had analyzed, and they saw there was not an increased risk of death related to migraine. But migraine can still make you feel for sure like you're going to die. And there are conditions that are associated with migraine that seem to make it worse, such as status migrainosus, which is migraine occurring over about 3 days where it feels like it's never going to stop. And there are treatments for that, but that's a terrible situation to go through. Anyone who's had chronic migraines, I've seen patients with 6 months, 20 years, 10 years of headache every day of varying degrees. That's a terrible situation to go through. Sometimes migraine will occur with a seizure that's called migrainelepsy, and they occur together at the same time, and the patient later will have to be treated with migraine medication and also with epilepsy type drugs. Persons can have thunderclap headaches, which occur on occasionally with exertion or sometimes sexual relations. These are 0 to 10 headaches that occur very quickly within seconds, scare everybody to death, and they should go to the emergency room and have a scan to be sure they don't have blood in their head or rupture of an aneurysm or something like that. Many of these are benign, but that needs to be checked out. There are also persons worry about migraine causing not only death, but can cause cognitive loss. And everybody's heard, many migraineurs have heard that there's little white dots that you see on the MRI scans in persons who have migraine. They're called microvascular T2 lesions by doctors and radiologists. And these have been studied carefully and are not related to death or stroke or to cognitive loss. So not to worry really about that. So these are my thoughts on migraine causing death. And in the end of that really is that we need to treat migraine at onset with a good drug like a triptan, and patients who are having frequent headaches should be on probably a preventive drug of some sort. They need to see a neurologist and check this all out. Many times they need to be examined and have a scan of the brain like a CT or MRI scan to be sure they're okay. So I hope this helps. Please click on like down there, and I'll see you again on the next talk.